Hi, Campbell here from Breath Body Therapy. I'm a certified Wim Hof Method Instructor. I'm also a physiotherapist and teach different varieties of breath work. And I wanted to take the time to instruct you on how to optimize your practice, specifically for the Wim Hof Method. I think too often we hear about something and I see lots of people that are interested in the method and that just dive in, which isn't a problem, but in terms of your practice, that the better you breathe or the more optimal your respiration, the more optimum the results, okay, and you'll get more from this practice. So rather than just going gung-ho, hell for leather, and just breathing in whatever way comes up, you can actually have a little bit more control over the experience and direct the response from your body. So I want to make this video for those getting started with the Wim Hof method to ensure that you're practicing in an optimal way. The first point is position. Okay, whether you want to practice sitting up or laying down is really your preference. My recommendation, especially as you get started with this method, is to lay down for your breath work. The reason being is, one, it's more relaxing for your body. It allows you to really let go of any tension and just get comfortable and enjoy the ride. The second is safety, especially as you get started in this practice. If you breathe in a really intense way, okay, without listening to the signals of the body and ignoring those signals, there's a chance that you might pass out. Okay, if you're laying down, we have this inbuilt safety mechanism that you'll just start breathing again. If you're sitting up and you pass out, there's a chance you'll fall and maybe you'll hurt yourself. Okay, so in terms of safety and comfort, I recommend laying down for your practice. The second, most people ask, do I breathe through my nose or my mouth? In a general sense, day to day, as you sort of move through the world, you should always be breathing through your nose. There is a filtration system. It humidifies the air, it filters the air, it draws the air right down to the base of your lungs. So we should always be breathing through the nose. Now, if you think about a sort of 15 or 20 minute Wim Hof method practice, this makes up a very, very small portion of your day. So if you feel that you can breathe in a better manner by opening the mouth, then I think that's fine. My recommendation is start with the nose, and as the rounds progress and you get more into the practice, then you can open the mouth for that sort of increase in intensity. If you start really fast and hard from the mouth, you've not given yourself much room to sort of progress. So I think it's important to start nice and slow and deep and build your way up to the more intense part of the practice. The way you breathe is really important. Depending on what position and the sort of manner or mechanism that you're using to breathe, we can almost redline the nervous system. So if you start your practice breathing with the mouth, breathing high up into the chest with quite a lot of intensity, okay, you're almost going to redline the nervous system. And the idea is that after the active phase of the breathing, I want to drop into this really parasympathetic, relaxed state. Now, it's like going from 100 kilometers an hour and screeching back to zero. It's not very gentle or relaxing. So I like to think of this idea of using gears, okay, building your way up with intensity and then dropping or downshifting the gears to drop into your retention. So don't go straight in as deep as you can, as fast as you can, as hard as you can. Build yourself up and bring yourself back down. The way I like to teach the method is it's this transition between active and passive. So you're breathing in a way that's quite stimulating for your body, but you want to also counter that by dropping into this beautiful still point that you find in the retention. So we want to start with the nose, we want to start breathing with the abdomen or the belly. Okay, we want to build the intensity throughout the practice, and we want to make sure that we're comfortable. This is going to help you enhance the benefits of the practice and drop into this really beautiful meditative state during the retention. So I'd like you to join me for a few tips and tricks, and then we're going to move through just one round of the practice. And this way you get an idea of the way that you should be breathing and the way that you should feel. And from there you can progress that to your second and third, maybe fourth round. So just for the sake of the video, I'm going to sit up, but I encourage you maybe to lay down and find a position of comfort. Place one hand on the belly and one hand on the chest, and for a moment just witness the air moving in and out. Okay? And take note of what part of your body is moving when you breathe. If you're finding that as you breathe in, the chest is elevating or the shoulders are lifting, I want you to consciously just bring your attention down to that bottom hand, okay? And as I breathe in, can I allow the belly to expand and fall? So I'm breathing right down to the base of my lungs, almost breathing into the belly. This is to ensure that we use the full capacity of the lungs. So just take a moment to try and find your breath and direct it down into the abdomen. Now what I want you to think about is as you increase the depth of your breath, the belly is going to move and then the chest will expand. So we begin to think of this wave. So you want the bottom hand to expand. As we keep breathing, the chest expands, and then we just let the wave crash. So your exhale is going to be out through an open mouth. We just sigh and let go. Breathing a little bit deeper than usual. I'm going to keep this rhythm. And as we might feel these sensations begin to arise in the body, maybe feeling a little bit lightheaded, or a heaviness or looseness coming over the body. Just know that you're in control. So drawing deep on the inhale, letting go of the exhale. Fall into a rhythm. Full inhale, easy exhale. Do 3 more. We let the exhale grow long. Down, shifting the gears. Relaxing. Settling into the weight of the body. Take one final inhale together. Just hold for a brief moment at the top. We're going to let the air go. When the air stops, you stop. And just gently hold. Relax the shoulders, relax the face, just relax the entire body, holding the breath after the exhale. Try and drop out of the head into the body. So we're not thinking, just trying to feel. And you're waiting for this first urge to breathe. Now, if that hasn't come yet, just wait. If you've already felt it, I want you to breathe in and hold. I'm just going to hold for another 5, 4, 3, 2, 1. Breathing in fully. And holding again at the top with full lungs, this fresh wave of oxygen working its way through the body. I'm going to hold for 10. 3, 2, 1, a big sigh. So that would make up 1 round of the Wim Hof method. The general idea is to practice 3 to 4 rounds. If you have any questions, please leave a comment below and I will get back to you. Campbell from Breath Body Therapy. I hope you find this useful and it starts your journey into all things